Hello, welcome to episode 14 this week of Ezy-Speech TV. I'm Lisa Hudson and with me is Dave and Jasper. And today we're going to talk about something that actually Jasper cannot do, has not learnt to do. I'm not sure that he'll be able to learn to do this one. But Dave is really good at it. We're going to talk about oscillation of speech.
So oscillation is one of the things recovering stutterers do to work on their techniques. And that's during the clinical process as well. When we first start to break down the individual's speech into the building blocks, we reduce their speech rate to extremely slow rates of, for example, 50 syllables per minute, which is extremely slow, but important for our brains to understand the process that we're trying to establish. That is, building the speech process up brick by brick. Normal fluent speakers don't even think about speech. It just comes out. Everything's in an organised pattern. Their breathing, their speaking, the wiring of the brain is all organised, and they say, you know, what's so difficult about speech? And to them, nothing. But because stuttering and people who stutter are different in terms of how their brain is wired, we think. There's no real known cause as yet. There's heritable possibilities. There's learned responses, perhaps, but we don't really know why people stutter. So for those people, and I'm talking in terms of the layman, not the speech pathologist, but for those people, for stutterers, we need to break down the whole process of speech. And breathing is the most important aspect.
Which is why we have covered a fair bit on breathing. So
That's
do
right.
go to our earlier episodes if you haven't watched those yet, because they are important.
That's right.
And also, it's kind of quite understandable that a stutter is likely to happen when you consider there are nearly 100 muscles involved in talking. So as I talk to you now, I'm using almost 100 muscles right now just to say these words. So it's quite logical that if you're going to learn to use those muscles effectively, you've got to start doing it very slowly.
That's right.
To get those muscles all in sync before you speed up.
So in the clinical situation, we move from 50 up to 100 syllables per minute, then up to more normal rates of 150 to 180. And we gradually increase the rate as the person learns the technique. However, it's very, very important, because all these systems and rates and breathing techniques aren't locked in place in the brain. It's important that we practice these on a daily basis. This is the importance of the mini booster on the program. So you can run through those, what we call foundation rates. You can practice at 100. Don't forget the good pausing. The pausing is the key. The breath is the motor that runs your whole technique. So oscillation is important. Even in real world situations, when you go outside, in a conversation, be aware of technique. The best time to practice is when you're feeling really fluent.
Yes.
So when you're out there having a conversation with someone, slip in a really controlled phrase every now and again. Did you hear that? A really controlled phase. Or when you're speaking on the phone, have some phrases ready. Good morning. It's Dave speaking. How are you today? So a nice controlled phrase. Sets you up for the whole conversation. The feeling's there.
Yeah.
I've got this. I can do this. That's wonderful. But oscillation within conversation is very important to remind you of your technique. Even slow right down to 50. Occasionally, when you're at home with your family, your children and friends. Give them an example of what you're doing. They'll think you sound a little bit strange, but hey, you know, you've got control over your disfluency.
Exactly, and that's one of the things it does, is it proves to you that right now you are in control.
That's it.
Just doing that little bit of oscillation and then back to your regular rate proves that you are in control. And one of the things that tends to happen is that when people are having a particularly fluent day, they think they don't need to practice on that day.
No, that's a problem.
It's a trap, isn't it?
Yeah. It's called carryover fluency. So if you're feeling really good from a previous, perhaps meeting on a one-to-one basis with someone, and you feel really in control and fluent, you can let all the practice aspects slip. And as soon as the breathing's out of coordination, you've lost that yin-yang type of breathing system, and the pause is no longer there, then everything can fall apart very quickly. But carryover fluency, when you're feeling good, can last a long time. But hey, don't let that fool you. You must. That's the very best time to practice and use your technique. So when you're running along, feeling fluent, be aware of the pause. Don't ever let the pause escape you. So think about the pause. When you do that, you're thinking about technique. And no matter what rate you're speaking at outside, you will be in control with that important pause. But don't forget, oscillation, so important when you're practicing at home or outside in the real world.
And the best time to do it is when you are having a really fluent run, or a purple patch, I've heard people say. Don't think your purple patch, oh, I'm good. Your purple patch is the time to practice. So don't be caught. So your take home from this week's episode is when you're having a fluent run, when you're having your purple patch, that's the time to use oscillation to practice. So do that for us this week.
Yeah, when you have the feeling of feeling fluent, take that with you. So if you're coming from a practice session, or you've just done the mini booster, and the phone rings, walk to the phone confidently and continue that technique with good breathing, slow onsets, and prepared phrases. It really does work.
It really does. Enjoy.